The state of Oklahoma calling its star witness to the stand this week in Norman as they move closer to resting their case against the Johnson & Johnson company for helping fuel the opioid crisis in America. Taking the stand, Terry White, the commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services. Jason Doyle reports on her testimony and what's next as this historic trial wrapped up its fourth week in the Cleveland County Courthouse.
All opioids were pushed. All opioids were pushed through unbranded marketing, and that is the problem.
That problem goes back to the early 2000s. More and more people were getting prescription opiate-based drugs to treat pain. Since 2007, thousands of Oklahomans have died from overdoses. The state is suing to get Johnson & Johnson and its affiliate Janssen to pay up to treat those addicted and help families dealing with loss. To get to that point, the state has come up with an opioid abatement plan, which creates care centers in many of our counties. It's called the Communities That Care model. Johnson & Johnson attorney Stephen Brody questioned Senior Director of Prevention Services for the Department of Mental Health, Jessica Hawkins, about the use of the model because it would likely include treatment for people not dealing with opioid addiction.
Well, first of all, I haven't done the math myself. So what I can tell you is that I've already testified that these costs and these interventions are reasonable and necessary. These are people projects. When you treat 35,000 people for opioid use disorder, you're hiring people and you're treating people with clinicians.
She says the costs are relative to the size of the crisis in Oklahoma. Brody also showed a graphic indicating the average salary of those potential workers hired in the abatement plan. It would be more than $70,000 a year. After being asked about the length of time that a drug to stop an opioid overdose would be made available in the abatement plan, Hawkins noted that it took a long time to build up to the crisis, and it'll take a long time to get out.
In my opinion, it will take at least 20 years to start seeing, I think, the types of reductions that you may be suggesting.
Grief support services also is in the abatement plan, with the pharmaceutical companies paying for it over a 30-year span.
The level of services that the plan requires Janssen & Johnson to fund will not go down.
5,000 people have died since 2007. They have loved ones who need these services for the next 30 years.
Department of Mental Health and Substance Abuse Services Commissioner Terry White was called to the stand by the state as an expert witness to discuss both the opioid crisis and the abatement plan. The defense brought up drug utilization board meetings spanning over 20 years ago. During those meetings, opioid use was discussed. Brody contends that the board, which advises the Oklahoma Health Care Authority, knew in 2001 that OxyContin use was on the rise among Medicaid patients.
The causes of the opioid crisis, would you agree that what West Virginia was doing and the limits that they were proposing were a reasonable step for a state to take?
I don't know enough about what was going on in West Virginia at that time to say whether it was a reasonable step to take or not.
Brody used West Virginia's actions to show that Oklahoma could have adopted the same limits in 2001.
I'm asking you if the state of Oklahoma adopted a prior authorization requirement for OxyContin back in 2001.
I don't know.
Not something you looked at in forming your opinions as to the causes of the opioid crisis in the state of Oklahoma?
No, that's not something I looked at.
Brody continued to use the tactic of bringing up past meetings of the Drug Utilization Board and their actions, or non-actions, concerning opioid abuse in Oklahoma. The defense also took the approach of trying to get White to set a number of how much is too much when it comes to the oversupply of opioids.
I think when you look at the data and you look what was happening pre-96 in terms of availability of all opioid products versus what was happening in 2008, it can give you a pretty good ballpark of what oversupply looks like, and returning to pre-96 levels would not be an oversupply. Now, for Duragesic specifically, I can't give you a specific number. I can tell you we have an oversupply of all opioids, which is the problem.
White wrapped up her testimony Wednesday, and the defense called its first witness Thursday.
All right, thank you.
Now, Jason Joyle is joining us now. This trial expected to last 6 to 8 weeks. Are we still on line for that?
Yes, we're just about at the halfway point, and while the defense called its first witness this week, the state's case isn't quite over yet. They'll be allowed to call one more witness who just happened to be on vacation this week. We should expect another month as Johnson & Johnson presents its case.
Okay, thank you very much.